Hello, my name is Andrew Burgee, and I'm the Hazardous Materials Training Coordinator for the NYU School of Global Public Health's Hazardous Wasteworker Training Grant for our grantor, NIEHS. Welcome to our COVID-19 Exposure Recognition module. This module focuses on the occupations, work settings, and job activities that are at high risk for COVID-19 virus exposure, and differentiating among high, medium, and low risk exposures. There are three main ways for substances to get into one's body. Inhalation is the most likely because we have to breathe constantly. To understand risk, we must differentiate between a hazard and risk. A hazard has the ability to cause injury or illness. An example is poison in a bottle. Whether you drink it or not, it has the ability to cause harm. A risk has the probability to cause injury or illness. Exposure determines the risk. A closed bottle of poison is a low risk. If there's no route of entry, it cannot cause harm. However, an open bottle of poison is a high risk. Once it has a route of entry inside the body, it can cause damage, be it inhalation, ingestion, or absorption. When we look at this risk assessment grid, we see that where the severity of impact or harm is low and the likelihood of occurrence or exposure is low, then the environment is safer. When the severity of harm is high and the likelihood of exposure is high, then the environment is dangerous. How does that translate to COVID-19 exposure? With COVID-19, the higher the concentration of contaminated droplets and aerosols in the air that a healthy person can be exposed to, the more likely that healthy person will be infected. Therefore, a crowded place with a high volume of sick people in close quarters will be a much higher risk environment than an uncrowded place with a low volume of sick people that are spread out. Let's look at some occupations, work settings, and job activities that illustrate this risk matrix. High exposure risk occupations are those working with people with known or suspected COVID-19, especially while performing aerosol or droplet generating procedures. Some occupations that have a high potential of exposure are as follows: healthcare workers, paramedic EMTs, and laboratorians. Some work settings that have a high potential of exposure are as follows: healthcare, laboratories, and emergency medical services. Some job activities that have a high potential of exposure are as follows: care for COVID-19 patients, working with specimens in a laboratory, and transport to hospitals. In each case, based on the occupation, work setting, and job activity, they are continually exposed to a high volume of sickly people in very close quarters. Medium work settings are generally more socially distanced with lesser face time with known or suspected COVID carriers in non-healthcare environments. Some work settings that have a medium potential for exposure are as follows: retail stores, public transportation, and home visiting occupations. Some job activities that have a medium potential of exposure are as follows: stocking shelves, checking out customers in retail settings, and emergency home repairs. Low potential for exposure occupations are those that do not require contact with people known to be infected, nor frequent contact with the public, especially when social distancing and testing protocols are incorporated that limit the number or proximity of people in a room and check body temperatures and screen occupants for infection. This is a mini quiz. Please answer the following two questions. Which item below is not part of a high-risk exposure scenario? Caring for COVID-19 patients, working with specimens in laboratories, or stocking shelves? Which item below is not part of a high-risk working environment? Healthcare, home visiting occupations, or laboratories? Because of a higher concentration of contaminated droplets and aerosols in the air that a healthy person can be exposed to, a crowded place where a high volume of sick people in close quarters will be a much higher risk environment than a lesser crowded place with a low volume of potentially sick people spread out. In summary, high exposure risk situations are those who work with people with known or suspected COVID-19, especially while performing aerosol or droplet generating procedures. Some occupations, work settings, and job activities have a high potential of exposure, such as those of hospital healthcare workers. That concludes Module 9, the final module. Be safe and thank you for your time.